who is going to lead off as a speaker from the regional service centers? Who would like to do the first?
Council President Katz, I think yes. Maybe Roberto can start, and all of them are on the call, and I think we send you the updated report as well. Just as usual, maybe Roberto, do you want to start?
Sure.
Okay. Please.
And I'll be mercifully brief. As I've said before, there isn't much happening in Silver Spring, right? As we speak, I don't know if you may have heard there was a derailment of trains there at the Silver Spring station. No injuries that we know of at the time, and of course our full force is there from fire and police, and we're staying in touch through our with the fire, police, and our urban district folks. My understanding as of this moment is that according to the PIO from Fire and Rescue, is that they're on Twitter, that there are no injuries at the moment. So just wanted to put that up front. We may hear differently in the next few minutes. In Silver Spring, I just want to say this, working with the advisory groups and our web of a network of community groups, the whole issue of food insecurity continues to increase. And thanks to the Montgomery County Food Council and what Jeru Bande has taught all of us about grab and goes and many other pieces, we're trying to address it in a comprehensive yet somewhat, and I say this in a positive word, somewhat disjointed, in the sense that there are a lot of folks doing different things that we may not hear about till after the fact, and that's a good thing. And so we are now working formally with our Health and Human Services to see about how we may work, particularly with a couple of different faith communities. Front row center is Clifton Park Baptist, who has an aggressive food distribution delivery, and they have the willingness and wanting to be there with us, and because this has to be from the ground up. So that's the food distribution piece, which looms large amongst us. On the opening and reopening, Georgia Avenue Street Dine we're past the pilot phase. We're doing some corrective action, literally, with some of the restaurants that had and late night spots that had to be enforced for closing. The vast majority are doing okay. Since it's an arts and entertainment district, we've introduced some whimsical but serious messages through mimes and folks on stilts to walk around and with a mask and say, look, gotta be social distance, mask, take it seriously. So those two pieces have consumed a lot of the work. Then the third one I want to mention, as I always do, because the folks in Long Branch, through the Long Branch Partners, are doing amazing work through their member or participating organizations. Sheer at Tacoma Park, Long Branch is starting to do home delivery of food to specific homes. And so anyway, I could go on and on, but I'll stop it there.
Hi, Sydney. I just want to interrupt. This is Carolyn. We do not have video for everybody yet. So I just want to make a note that Ken and Jeru are online, but their videos are not on.
Okay, thank you, Carolyn. So Fariba, who was the next?
I think Ken can go next. Actually, they can go next. Whoever wants to go next, yes.
Okay, there's Ken.
Just in time.
Right, there you go.
How is everyone? So
Good.
we're proceeding along the same lines as Roberto. We've been talking to businesses in downtown Bethesda, the Urban Partnership and the Chamber, about compliance issues, answering questions, trying to get ahead of any potential problems. That work's continuing. We've had a big success. You know, the Bethesda Urban Partnership needs a lot of kudos for what they've done with the streeteries. It's just been a phenomenal success and all around very well received by the businesses and by the community at large. There is a hope that some of these closures may become permanent in the future, but we'll get to that bridge. We'll cross that bridge when we get to it. At the same time, we're getting ready to announce the opening of outdoor eating areas in the Pike District. Our contractor up there has been working on 4 different locations in and around Rockville Pike and the conference center, where there'll be picnic tables, some flower pots, LED solar lights, where people can choose to dine out. With great partnerships all around with our landscaper and with the conference center to help with some of the cleaning. But look for that announcement hopefully today. We're working with PIO on a release. A great addition to that community. And then just to touch on it, we are continuing to work with our Glen Echo partnership. They're working on a reopening plan for the Glen Echo Park that will be done in phases. Like a rec center or the libraries, that there's a great concern about indoor activities, but they're hoping to begin outdoor activities shortly, and we'll work with the National Park Service to get that up and going. Happy to answer any questions. Of course, I want to take a moment to just say what a pleasure it's been working with everyone on this team, regional center directors, Office of Community Partnerships, and the Commission for Women on our special populations outreach. And because we can't do any of this without our connections to our community serving partners, and everyone in some way has contributed greatly to moving the effort forward. But again, I'll stop there and happy to take questions.
Thank you. Fariba, who is next?
I think Juru can go next. Juru, if you're on the call.
Thank you. As Roberto indicated, many of us are involved in the food distribution initiatives in East County. As some of you may be aware, probably we have the largest, if not one of the largest food distribution events, not only during the weekends, but during the weekdays in particular. We have about 7 or 8 major food providers engaged in these activities: the People's Community Baptist Church, Kingdom Fellowship, Rainbow CDC, the American Diversity Group, the Sri Mangal Hindu Temple in Ashton, Kings and Priests, New Hampshire, and the Abundant Grace. So the way we structure this is to make sure that all different communities have access to food, whether you're in White Oak, Briggs Cheney, Fairland, in the 20905 areas that covers Cloverly and Spencerville, Ashton, and Bordensville. In addition to that, the other strategy the regional office is really zooming on is making sure that some of the hard to serve, hard to reach populations living in high density apartment communities in East County, particularly in the 2 major census tracts along Lockwood Drive in White Oak and Castle Boulevard in Briggs Cheney, where you have these large apartment complexes like the White Oak Towers, Waterford, the Windsor Court, the Vistas, and the Enclaves actually getting it. So we take these services to their doorstep, curbside. That allows us not only to provide food, but we invite a number of other partners, including the African American Health Programs. We do outreach for the Census 2020, COVID-19 awareness, food access, and invite some of our community partners like the Soccer Youth Development Program, Coach 44 leads, and a number of other county agencies. This way, we are really in direct touch with the residents. We do practice the social distance requirements and all the other health precautions while we do this. Our volunteers are highly trained through the agencies that are funded by the county, as well as the Food Security Task Force. So that's very, very, very important. And on any given week, we have about 7 or 8 food distribution events in the Eastern region. And this is very vital. We're getting some very, very good, excellent feedback. Through this program, we're also getting a lot of intelligence from the tenants, i.e., when we go out there, we do have some of our HHS caseworkers who are part of the East County Initiative who are there to really take questions or requests from the tenants. And we're beginning to see a lot of requests on the back rent, requests on insurance, requests on food stamps, and other health and human services that they needed. So technically the caseload for the staff that volunteer to be part of the food distribution is growing through that strategy. The other area the regional office is highly engaged in is the assistance to the business community. Unlike other regions, I don't have urban districts or other structures to do as much as my other colleagues. However, there's a very close working relationship with the property managers and the businesses in the 5 retail areas in Bortonsville, Briggs Cheney, Hillandale, Cherry Hill, and the White Oak Shopping Center. There's a strong relationship with the businesses as we continue to promote the Take Out Tuesday campaign. Currently, we have 50, 60 plus businesses enrolled in that program, and they're also enrolled in the Morco Eats program. And this has really proven to be very successful for many of those businesses. In that process, in talking to many of them, you also get to understand what some of their next biggest issues are, like back rent, for example. Really not feeling very good to following or just laying off some of their most valued employees. So workforce development related issues, reemployment becomes a major issue for many of those businesses. Besides that, I'm working with the other departments like the Department of General Services and the Department of Transportation on the Flash, along the BRT Flash project between Bortonsville and downtown Silver Spring, the 11 stations that they're building. It's coming along slowly, even though we've been affected by the pandemics, but also the large 122 unit senior housing development right in front of the East County Regional Office. We anticipate having a ribbon cutting in late August. So we'll have everyone in tune with that. But for the sake of time, I'll stop there. And if you have any questions, we'll be glad to answer them as we discuss further. Thank you.
Thank you.
Yes, thank you. Louisa, do you want to go next?
Sure. Thank you. Good afternoon, everybody. Yeah, so I guess I'll start just with this week, because we had our Wheaton Urban District team, our Clean and Safe team, working really a skeleton crew, and they, as of this week, yesterday, we're reconstituting that workforce, and there's a lot to do because of the reopening a couple of weeks ago with the businesses. There is more activity. There's a little bit more traffic, both vehicular and pedestrian, on the streets. Of course, Westfield Mall also reopened a couple of weeks ago. And as an aside, we really worked closely with Westfield. Obviously, the Costco and Target had been open throughout. However, they opened about 100 of their 150 stores a couple of weeks ago, and worked very closely with the county to ensure that they were following the guidelines. The ambassadors visited them on a couple of different times. And for the most part, it's gone well. We haven't had many complaints, if any, that I've heard of recently anyway, from Westfield. So both the reconstitution of the workforce and the reopening of our businesses in Westfield, both of those things, I think, good thing that we're actually reconstituted the workforce this week, because there's a lot to be done there. We also in Wheaton have a streetery following the concept in Bethesda and Silver Spring. It's in the Price, Fern, and Elkin area. 7 different restaurants participated and coordinated with us in the county, ABS, DPS, MCDOT to close a street there. And actually, we're expanding it just slightly in the next couple of days to include another restaurant that got permitted for outdoor seating. So going well there, a lot of communication with the businesses to ensure that everyone else has access to their business and that, you know, traffic flow is working. I think along the same lines, I think Jeru might have just mentioned that one of the biggest concerns, of course, that looms large from the business sector is rent and leases. You know, again, that's an issue that many are concerned with, even those that have reopened, and something that we're going to be, I'm sure, keeping an eye on and talking to you all about. In terms of, again, just like the other areas and the other regions, food insecurity and food access. There are many groups working in the Mid-County, particularly in the Wheaton, Glenmont, Aspen Hill area, to serve a growing need. However, it still doesn't seem to be enough. And so we've been working with DHHS and the Montgomery Food Council and Security Task Force to also stand up a hub, or not even just one hub, but it looks like potentially a couple of different hubs, or even the idea of a couple of hubs and then spokes that are supported out beyond the hub. And the place that we are standing up first is the Hughes Memorial Methodist Church, which is on Georgia Avenue, just south of Wheaton. They were already doing some food distribution and already doing a small amount of food deliveries. That just in the last couple of weeks, with the county's assistance and some of the other providers coming in, we've been able to expand that. However, I would not at this point yet call it a hub. What we're working on in terms of the next step is bringing in more partners, but they have increased their capacity, where DHHS is increasing their storage capacity by helping them with some refrigeration, and also looking at actually funding from the county so that Hughes can have a coordinator that is just focused on building this out. Again, part of this food hub model is that the county's there to support and to help and fill the gaps, but not to lead the initiative. And so really looking at partners and folks in the community that are willing and have the capacity to get out there and do it themselves. And then we are there, the county's there to help in whatever way we can to fill the gaps and ensure that they have the resources to do what they see in the community that they need to do. You know, the only other thing I'll mention, and then if there's any questions, is we're continuing, despite the fact that COVID delayed the opening of the new building in the town plaza in Wheaton, and it's going to change. It truly is going to change the ideas, some of the ideas that we had about activating the plaza and moving into the building. On the other hand, we've continued to do work. We're working with a marketing company to put some promotional materials together, to put some welcome packets together for the new tenants, to continue to rebrand some aspects of what we're doing in Wheaton, to add signage to the town plaza. So all of that has been ongoing, despite the fact that a ribbon cutting and the opening of the building is still yet to be determined. No new date for that yet. Although it does look like the move of the tenants will occur sometime in August, probably into September. And again, our advisory boards continue to meet, and they've been very active virtually. It's reshaped the work that they do, but we've continued to meet, and they've continued to provide inputs. One of the things that we're looking at, and all of us are looking at this going down the road in the near future, is actually providing racial equity training to our board members, particularly our citizens advisory boards, but also our urban district boards, and even our commissions and some of the OCP liaison boards as well. You all may know that we had a really valuable training last week, the senior management team with MCPS racial equity unit. And we'd like to replicate that with our citizens advisory board. So working with Tiffany Ward and others to see how we can put that in place. And I think I'll stop there.
Okay,
Happy
thank
to answer
you.
any questions.
And finally, Kathy Mathews.
Hello, everybody. Usually I go first, so I'm not used to going last here. So
Sorry.
I think everybody said everything. No, I'm just teasing.
Mm-mm.
I just wanted to say, in terms of reopening Up County, things are going well. I think it's been such a benefit to have 3 chambers of commerce who have really jumped in and held a lot of workshops and seminars for the businesses. We have the 5 municipalities that have been doing what they can to help their businesses as well. So the only concerns that I'm hearing kind of echo what Louisa was saying, was rents. People are worried about their rents, and kind of worried about, even if I open, will enough customers actually come back this soon or in the next couple of months? So that anxiety is out there a little bit. In terms of reopening again, a streetery has been established in Germantown. And some of you might remember that Germantown doesn't always do things the way other parts of the county does it. We started out celebrating Independence Day on July 3rd years ago, until they realized maybe we should just switch it to the 4th. But the streetery in Germantown looks a little different. It is located on the town commons, on the lawn that's right in front of Black Rock Center for the Arts. And Black Rock is considered to be the host for that. So they are staffing the tables, cleaning them, and making sure there's the proper distancing taking place, and that face masks are being used. It was decided among some of the community leaders and our transportation folks and myself and some others that we would try it this way, because our streets in Germantown are a little different. And Councilmember Rice and I've talked about this a number of times. We don't, in Germantown, in the commercial area, we don't have the street grid that you find in Wheaton, Silver Spring, and Bethesda and other places. So there aren't too many opportunities for easy detours if somebody comes across a blocked street. The other thing is, because Century Boulevard is our one main street down the middle of town, it's kind of difficult to get from point A to point B easily without going out onto a major roadway, Route 118. And a lot of people have said that, once they get out to that point, they might as well keep going. So we thought, let's use what we have. We're still looking to possibly block off a part of Pinnacle Drive, but for now, the lawn is being used, and it looks great in the evening. Hopefully it'll catch on. And a special feature of the lawn, the town commons, is that the neighboring businesses, restaurants, have agreed to even deliver to the lawn for pickup. So there's a special pickup table, and you can find yourself a table, sit and relax and have conversation, place your order, and soon your meal will arrive. So we're really happy about that. In terms of COVID testing, you know that we do have a test site in Germantown. Originally, it was at the Up County Regional Services Center, and it was moved to the garage behind the movie theater, and it seems to be working well. I'm working with our HHS folks and Topgolf to make sure that the garage will continue to work now that Topgolf is reopened, and many of their employees park in that garage. We just want to make sure that everything runs smoothly with those two uses in the same space. In terms of the Up County Food Hub, I think everybody knows that we kind of started this concept at Black Rock Center for the Arts, and it has served as a good model for Gaithersburg, Wheaton, Silver Spring, and others that'll be coming on board. Keeping in mind that the great work that Giroux's been doing over in East County with the grab and goes and other places around the county, the community leaders thought that this model was probably better for the Germantown and surrounding areas, and that is to have food donations dropped off at Black Rock, and they've set up their gallery, the art gallery, as the sorting facility, basically. And then volunteers arrive on Tuesdays and Thursday mornings to actually take boxes out and deliver them to families who have been referred or families who've called for assistance. on one of those days, most of the boxes are going directly to families or households that are dealing with a family member who has been diagnosed with the virus. So we wanted people to be able to stay in and still receive some assistance, and so they get food, fresh produce. We put together a COVID kit that has thermometers, masks, and other items that would be helpful to somebody who is really sick. And so they'll get extra juices, etc. So we find that model is working really well. We're even expanding that, and that HHS has talked to, I think, most of us, most of the regional directors, in terms of placing somebody, a case manager or case navigator, at the hub to help with clients' other needs. As we know, very rarely is something in isolation. There's usually a related problem as well. So this person will be able to connect those families with the other services that they do need. Something we found from working the hub this way is housing instability is on the rise. There was one family in particular that had to move 3 times within like a month. And it's we're finding more and more of that as people are worried about not being able to pay their rents. So having someone at the hub who can help with these other resources or direct people in the right way will be even better. This whole concept is a part of what the Thriving Germantown was about, putting together a hub with multiple services, et cetera. And a little side note from what we're doing with Thriving Germantown is we're planning a census party with some of their clients who have not taken the census yet. We'll get everybody online and they'll do it together as a group. So one other thing I did want to mention is there's a lot of work going on at the Up County Regional Services Center. The building is still closed. It was closed April 6th, but you'll see that there's a lot of activity there. We're getting the elevators replaced. We're getting new pavement done. Wi-Fi is going to be fortified. Some modifications to the child care center entrance. So you'll see a lot of work, but just keep in mind that the building is still closed to the public, and hopefully everything will be in place when we start bringing people back. If anyone has any questions.
Thank you. Fariba? You're on mute. Fariba, you're on mute.
No, thank you. I just wanted to emphasize that how valuable having the 5 regional service centers giving us input and guidance, especially for the past 4 months. I mean, everything, every services, every issues we had, COVID, non-COVID related, they were super instrumental. I know Council President Katz, you know that, every council members realize that, but I personally did not realize that how much we're going to be tapping into their knowledge, their understanding of the community. So just want to thank them.
Thank you very much. And we did know that, Fariba, believe me.
I know.
Believe me, we knew it. Very good. Thank you. Councilmember Friedson.
Yeah, just on that point, first of all, I wanted to thank all the regional service center directors and your teams. We're in an unprecedented moment. You are always utility players. That's the way that the system is set up and your roles have been designed. But in unprecedented moments, the other duties as assigned column of your job description has grown in importance. And I really do appreciate that. I appreciate, in particular, I've been to the Silver Spring Street Dine. I've been to the Wheaton Streetery. I've enjoyed Burtonsville and some of the outdoor seating, turning the parking spaces and parking lots into outdoor seating to help those locally owned businesses. And obviously I spent a lot of time in the Bethesda Streetery and Kathy, soon enough I have plans to make it up to Germantown to check out Black Rock and see what you've done there a little bit differently, but the same idea. I'm really proud to see that the model is working and responsive to the unique needs of each community and each dynamic, and all of county government has really stepped up in a number of different ways to coordinate and collaborate. I know each of you have been involved in those different efforts, so I wanted to thank you for that in particular. did have a question for Mr. Hartman about the Pike district and the outdoor seating that you're talking about there. Could you explain? I know you said there was going to be an announcement coming out today. Could you explain what the areas are that are being looked at and how that process would work and who'd be responsible for it?
I'd be happy to. So we're looking at, well, we are implementing 4 areas in and around Rockville Pike. One is there is a large grassy area just north of the new conference center garage. We have repurposed that space with distance circles. You may have seen those from other cities around the country where there are these circles in the grass that are spaced to allow people to self distance from one another. To that, we've added a number of picnic tables. We've added LED lights, some flower planters. We have a contractor that helps us maintain the medians of Rockville Pike. They are extending their duty to also make sure that area is weeded and maintained and the flowers are watered. That space will also be used for some outdoor exercise classes. You're using the circles, of course, to space people apart. And the conference center is helping us in cleaning the tables and monitoring the space. Moving from there on the southeast corner of Old Georgetown Road and Rockville Pike, we'll be installing additional picnic tables and social distance circles. It won't be as involved as the one by the conference center, but another space for people to eat outside. And then moving south from there, we will have a space at there's a brick plaza in front of the conference center right on Rockville Pike and Marinelli. We're adding outdoor seating in that location as well. And the final location, just to remind myself, final location is in front of Wall Park. We're working with the Parks Department on a plan to do the same, to add outdoor seating and to create a space for outdoor activities. And just to let you know, Councilmember Friedson, in and around the conference center, this is the space we have is very close to the Western Workaround project. So we've managed to put up banners on the construction fence of the Western Workaround on multiple sides that contain messages about Montgomery County's ethics, about diversity, being part of the change, and other great messages that people need in this time in our lives. That's all we have for now for what we're about to do. I
appreciate it. If you could loop us in a little bit more on plans and as
Sure.
This is progressing, I think that'd be great. As you know, we're heavily involved and continue to be heavily involved in the Bethesda Streetery and figuring out how that was going to work and working with the Chamber and with Bethesda Urban Partnership and working through specific issues and actually extending the locations of where that actually was going to end up being and what the hours would look like. We've been an intimate part of that conversation from the outset, and it would be helpful and appreciated if we were actually included with some ongoing communication and involvement in what happens in the Pike District as the district council members. So I would appreciate it.
Yeah, happy to. We did talk with Cindy about a week ago. I'll shoot you over the update that went out to the White Flint Downtown Advisory Committee that Cindy also received, but I'll shoot it to you personally.
Thank you.
Thank you. Councilmember Navarro.
Thank you, Mr. President, and thank you to all of you for outstanding work. Everything that you are doing is just really important to us. I had a conversation with Dr. Kroll regarding the concept of the hub model as it was being discussed for Wheaton. And one of the things I talked to him about was the fact that there's no doubt that every area of the county is a little bit different in terms of the logistics or the, you know, pieces that come together, and that we shouldn't think that because a model such as the one that is going on in Germantown, which kind of had, you know, Thriving Germantown, it had Grace Rivera Oven with the Blair Foundation putting money up front, et cetera. Just because that model sort of came together there, that we shouldn't pursue different variations to achieve basically the same goal, which is to have a centralized place where community members can access this myriad of support, especially when we're talking about areas with the highly impacted zip codes. And also when you know that you have areas with a high concentration of immigrant and or low income people. And I discussed with him the fact that like in Wheaton, you know, we have this COVID-19 CARES Act money. We could very well invest in, you know, hiring folks like we did with the health promoters in lieu of the volunteers that we are waiting to materialize in order to get this done. And even though the model in Germantown is heavily led by the community, why would we not just own a big part of that logistic as county government in order to achieve, like I said, the same goals? So I'm still a little bit puzzled, you know, why that hasn't happened. I feel like, you know, the clock is ticking, and I literally had this conversation like 3 weeks ago or more, a feeling that we were already a little bit behind, right? That if we know that we have similar demographics in a part of the county and that approach is working, why wouldn't we immediately try to replicate the overall template where we know that we have similar challenges? And so I guess I'm just still a little bit puzzled as to why we haven't done that, right? If there's an issue of capacity, again, we have resources, we have, you know, ways of doing this. And particularly in the Wheaton area, you know, we just had our update with Dr. Gales. Here we are, you know, as he said, the numbers continue to show that particularly the Latino community continues to be disproportionately affected at a very high rate, actually. And obviously Wheaton is sort of the epicenter of the Latino community. So it's another instance where I'm just, again, getting a little bit frustrated about just having upbeat conversations and offering so many recommendations that just don't, you know, that just don't get followed up upon. So I don't know, Ms. Kasiri, if, you know, if you have any feedback on that, why haven't we taken advantage of that extraordinary model that came together in Germantown, and again, implement it, knowing that of course not everything is going to be exactly the same, but we are able, I think we're very creative and innovative. This council has also shown that we are, you know, we've stepped up to recommend so many things, right? Including the multilingual, multicultural teams. You know, it's something that we put together. How come that hasn't happened, particularly in Wheaton? I'm sorry, you're muted, Ms. Kasiri.
Ms. Navarro, I just took a note and take back a little talk, but Luisa, if you want to add to it, but I heard you loud and clear, Ms. Navarro.
Yeah, because I know Ms. Montero Diaz has done such extraordinary work. And, you know, she is one person. And yes, you know, we fought hard. I know I fought hard to make sure that we get some additional resources for the regional services centers and the red shirts, et cetera. But it really, I think, has to do with more the administration providing Ms. Montero with the capacity to stand this up. You know, we really need to get that done. I mean, we surely do. I mean, this community, you know, again, really deserves to have that kind of support. And once again, especially as we're talking all day long about racial equity and social justice, again, this is a zip code that has consistently shown that is highly impacted. And so it's super frustrating. I mean, as a council member, you know, I'm not in charge of county government, so I can't sit here and you know, deploy anything. All I can do is be as vocal as possible to help this move forward. But now it's, here we are having the same conversation again. So we really appreciate it if I could get some specifics as to the timeline and what is still the holdup on getting this this done.
Okay.
Thank you.
Thank you. We have three council members that want to speak. We have a little over 15 minutes. So if everybody could keep it to about 5 minutes so we can be on time, please. Councilmember Albernaz, I don't want to give you a complex. Every time you want to speak, I go through this speech. Anyhow, go ahead, please.
I have 4 kids. I'm used to it. So don't have a lot of time to speak at home either. Thank you all again. You guys are doing incredible work. I've had the opportunity to visit several of the hubs, and what I think is something we shouldn't lose sight of is that there are practices that are being developed both in communication and community engagement that need to live beyond the pandemic. And so if you guys can keep a running tab, and I know it's not a cookie cutter, it's going to be a little different in each of the 5 areas, but those programming models, those communication models, those policy models, the closure of the streets has been magnificent in Bethesda and in other parts of the county as well, and has really significantly enhanced our nighttime economy. And that should live beyond the pandemic, which is, I think the kind of policy recommendations that I'm hoping all of you are keeping a running tab of, so that coming out of this, we can continue to expand. I'm particularly interested in the methods you guys are using to communicate to the public right now, which have greatly expanded on the council as well. I just had one question with regards to testing, and Kathy, I know you had mentioned this in your comments and others as well, but can you guys describe for me exactly what the interaction with HHS looks like for each of you? When are you brought into these decisions? Are you part of the team as the hubs, not the hubs, but also the testing sites are included? Do you have the capacity to participate actively in those teams? I shared this concern in our session with Dr. Gales this morning. I think he is extraordinarily talented, surrounded by extraordinarily talented people, but I am concerned that he doesn't have enough hands on deck to be able to actually implement the development of the test sites in the way that we need to. And we've known for months. And now that we have more of the test kits available, that's not an excuse anymore. And so how are you guys engaged in that conversation with HHS? We've asked for Dr. Gales, as an example, to produce a written plan. And I certainly hope that you are advising or engaged in some way in the development of that plan. So it's sort of an open-ended question. I don't know if all 5 of you need to answer, but I'd appreciate getting a better understanding. And that's my last question, Council President.
Council President, you're muted.
Please jump in. Whoever would like to answer, please.
Can I start, Kathy?
Sure. Go ahead.
So just overall, as Dr. Gales was looking at expanding test sites, the 5 of us have all developed a list of community partners and community organizations. We've had follow-up meetings and helped with outreach to places such as St. Camillus and Casa de Maryland on partnerships for testing that are conversations are still ongoing to get those out of the gate. But they, and I know Jeru and Kathy and the others will all speak to their direct involvement on testing and food and services in their areas. But from my perspective, we've all had seats at the table, so to speak, in the development of service delivery.
Yeah, I'll just jump in and say that's been the case with me, to council member. In terms of looking for testing sites, for instance, Mark Hodge or Dr. Crowell will call and we'll talk about possible sites. We just arranged for a pop-up at the Middlebrook Gardens neighborhood, the mobile homes community, and that took a lot of not negotiating, but a lot of talks with the property owner, and we got that done. So we've been talking all along. In terms of testing, in terms of additional resources that might be needed, how maybe getting more volunteers from some of our community organizations can help augment what the HHS staff can do.
And also working with our local jurisdictions in the case of Tacoma Park, and they did one. We did one for Tacoma Park residents mostly. That proved to be successful, and actually testing the test sites. Glad to say that my own son, actually Jeru, went out to White Oak. Very simple. So and the whole sequence, and thank God he is negative, and so the challenge now though is taking those test sites to where people don't need to drive. And because there's a lot of folks south of the Beltway that driving to anywhere remains a challenge. So that does remain a challenge as to how we can take the testing to the people that can't drive.
Yeah, Councilmember Albanov, Dr. Travis Gale had a meeting with me and Robin Riley, the Director of Recreation. And I do know as we speak, Robin is doing a site visit with someone from that office looking at the recreation centers as one of the 3 different options that we talked about last week. The goal here is to identify locations where those test sites are accessible to the residents we want to serve, either through the mega food distribution sites like in White Oak and Briggs Cheney, but also using other assets like the mobile medical center that's already there, with capacity to start something very quickly and get it going. But yes, we've talked about the need to get something going more beyond just the DMV test site on US 29. We are working on the operations plan on that, so hopefully we'll get something set in East County very, very quickly.
Thank you. Councilmember Glass, please.
Hi, good afternoon, everybody. Thank you. I just like everybody else, I've been to most of your regional hubs and seen everything that you've been doing, and so I'll just be brief with my questions. 2 questions. One, we were just having a conversation with Dr. Gales and Stoddard about people reporting incidents when they see businesses not adhering to protocol. And I'm just curious what you're hearing and assuming that you're directing people to 311, but I know a lot of people on the listservs and others are just going directly to a lot of views. So are you hearing and seeing of many incidents where businesses or others are not adhering to protocols?
If I might say there, Councilman, the most heartwarming things I hear is in the relationship that many of our residents have with existing businesses, and they take it upon themselves to check in with the business and say, hey, come on, man, the wait staff is not wearing the mask. And so I think the more we can encourage that and do that as a community, it alleviates a lot of other situations. And that's working. Where folks don't feel comfortable doing that, yes, of course, 311 remains the go-to place. But I do want to emphasize that community to community, people to people thing of the folks that know the restaurant owners, many of them do, or the staff to bringing it up themselves. Hey, wear that mask, wear that glove.
I would just also add, and Councilmember Friedson, I think you're a member of the small business work group that's been meeting on a regular basis as part of the recovery framework, and this has come up in that discussion. And so the chambers are also valuable partners in communicating to their members this. And also a bit, I think what's come up there also is this issue of taking the onus, while the business is responsible, if there's a customers or a set of customers that are really pushing, the issue is for the county, for us to be able, through communication, through messaging, to help that business communicate with their customers better. Some businesses don't want to confront their customers if they're not complying with the restrictions. So it's been an issue that's been discussed in the work group, and I think the chambers have been really key partners in the communication part of it.
Well, that's good to hear that there's a level of self-reporting, some level of self-awareness, at least within between the patrons and the business owners. So that's good. And not hearing anything from you with regard to specific hotspots or types of businesses or in any geographic area where they're outliers, that's good information as well. And the last question I have is somewhat more of a comment, and it was mentioned earlier. I think Kathy was talking about, well, everyone was talking about the streeteries and all the goodness that is outside, all the food. And Kathy was talking about some of the different challenges and perspectives up in Germantown. And I had a staff member who went out with you and some others. And it was just really enlightening to me to hear about the different perspectives. Clearly we're a big county. And everyone is asking for similar amenities, but there are different challenges with our geography, the way the streets are laid out. And then quite frankly, some of the businesses and the ability for the small businesses to have the staff to be able to accommodate some of the outdoor streeteries. And I see the nodding from our up county representatives here, the district council member and Kathy. And so I just want to share for whoever's listening that we're all trying to make similar experiences here so that downtown Bethesda and Wheaton and Silver Spring, those experiences can be shared up county because people are asking for them, but there are different challenges, and look forward to working with you all, particularly Kathy and Councilmember Rice, to be able to bring to residents of Germantown those outdoor experiences, and we'll just fine tune it in the meantime. So just wanted to put that out there. I yield back, Mr. President.
Thank you very much, Councilmember Rice.
All right, so I'm going to try and be quick. Thank you very much for that, Councilmember Glass, because you're absolutely right. And it ties into what Councilmember Navarro was saying earlier about how we need to make sure that we understand that while our overall goal is the same and we want to make sure that we're giving folks the services that they know they need, how we're going about delivering those really is truly going to be unique to the communities that are there. And it's one in which, for me, Councilmember Navarro, I remember when Director Alawalia, who I love to death, she and I battled a little bit about setting up Thriving Germantown and the Thriving Germantown Hub. That was not something that was embraced when it first came out. And Kathy can tell you, I mean, she was there with many of the meetings where we had to push that along and really because it was something different. It was something outside of the box. And so certainly in your perspective, what we don't want to do is push a cookie cutter approach. I do support you in that it needs to be something that's unique to the needs of that area. Having the hub model is something that we've always embraced. I mean, keep in mind, it's the reason why our regional services centers exist. It was totally designed and set up in a way to provide that one-stop shop for everyone. It never really truly got to be able to do all of that with all of the challenges we had regarding funding and stripping of folks and their staff. And so we have all of these, directors who are doing yeoman's work with none of the staff that they used to have. And that's how we set this up in terms of what the service deliverables would be for those communities. And so we have to be real about that also, in that we've never built them back up to where they needed to be. And we knew that we had to go even farther than that. And so, for me, I've certainly seen the difference in being able to have this freestanding model that kind of separates itself a little bit, that is a quasi-governmental agency or entity in that sense, to be able to navigate. And I know that Councilmember Navarro, you know all too well about leveraging outside resources and outside dollars. You've done a great job of that in terms of early care and education. And so certainly that has benefited the Thriving Germantown Hub model as well. And something that we as a collective county need to talk about, because that's one of the challenges, right? Is that being able to leverage that additional funding, knowing that other jurisdictions, other neighborhoods, other communities aren't going to be able to leverage it the same way unless there's a philanthropy push in that particular area. Then how do you make it equitable, right? It's similar to our PTAs in our schools. It's the exact same problem. And so from that perspective, it's one in which I look forward to working with you and helping to support you along those lines of us really coming up with a county-wide support mechanism that's there, understanding that not all of those things are always going to be there in terms of that outside support, but that overall the procedure itself in terms of how we're doing this and how we're delivering needs to still happen. So looking forward to working with all of you in terms of how we try and stand something like this up and really make sure that the county fully supports it when we understand that those philanthropic dollars may not be there. So just wanted to put that out there.
Thank you very much.